My name is Diaz. I'm a licensed professional counselor and I'm the mental health therapist with Montezuma County Department of Social Services. In deciding whether or not to come here today, I thought about Dr. Seuss. Unless someone like you cares a whole awful lot, nothing's going to get better. It's not. Despite a fear of public speaking, I am here today to give testimony about our needs in Montezuma County. As I mentioned, I'm a licensed professional counselor and I specialize in trauma, attachment, and play therapy. I've lived in Montezuma County since 2015. I worked first at Access Health System in Cortez for 2 years and was able to obtain my license. I left Access in 2017 and accepted a position with the county which had a dual role, implementing a mental health program for child welfare and working as the primary therapist for the New Wings Day Treatment Program, a collaborative effort to help children who behaviorally cannot function in traditional academic environments. Fortunately, this summer, they hired a full-time therapist for the New Wings program, so I've been able to dedicate my time to child welfare. In preparing for this testimony, I felt the weight of all the challenges faced by our community on a daily basis. In Montezuma County, we are severely lacking in providers and programs to serve our increasingly high-need area. I spoke with clients, their family members, other therapists, and administrators in order to accurately present to you our needs. According to the U.S. Census Bureau, Montezuma County is continuing to diversify. We currently have people from white, Native American, Black, Hispanic, Latino, Asian backgrounds, and individuals of mixed race or heritage. We currently have a poverty rate of 15.2%, which ranks 14th out of 76 in our state. In addition to high levels of poverty, statistics from 2017 show that we have the 4th highest suicide rate, more than double the statewide average. In our community, we have the following resources to address these significant challenges. As been mentioned before, Access Health System in Cortez, it's our only community mental health center. It serves the entire county. It currently has openings for 2 full-time child and adolescent providers and 4 adult providers. Currently, they're relying on providers traveling to Montezuma County from other areas to help serve our population. Access has high turnover rates, in part because individuals either relocate to Durango or are living in Durango, and the commute is too much. When I worked there, I frequently felt overwhelmed with an extremely high caseload and an inability to see people with enough regularity to make a significant difference. Furthermore, I was the only bilingual Spanish provider and tried to help anyone I could with not only their mental health needs, but also case management and medical translation. I often saw Native American clients rely on family members to translate during moments of family crisis. Four Corners Youth Clinics is a school-based health center located at Southwest Open School campus and the Dolores School campus. They have had a part-time position listed since June and have received no licensed applicants. Mugon Behavioral Health Center is a new organization located at the Ute Mountain Ute Reservation. It was created to address the high needs of our Native American community in culturally sensitive ways. They have 2 openings for therapists. They report the challenge of obtaining licensed behavioral health professionals and inadequate salaries for individuals who are providing these services. The Dolores School District currently has an open elementary school counselor position as well as secondary school social worker position that are not filled. They report many struggles, including finding qualified staff and locating resources for families who do not have or do not qualify for Medicaid, leaving schools with extra pressure to provide a wide array of services. Other schools in Montezuma County are reportedly fully staffed. Smaller schools often do not have a school counselor to provide supportive services. These schools rely heavily on licensed clinical social workers and psychologists from the San Juan Board of Cooperative Education Services, BOCES. These individuals travel throughout the county and have various schools on their caseloads. Schools who are fortunate enough to have a school counselor or social worker in addition to BOCES rely on that individual for academic recommendations, crisis interventions, counseling, family outreach, social emotional curriculum, and connecting families to community resources. I am the only therapist with Montezuma County Social Services. I provide child protection therapy to parents, interactive therapy to parents and children, and trauma-focused play therapy to children involved in the child welfare system. The Child Advocacy Center, which is our community's resource for children during the investigation and prosecution of child abuse cases, only has 1 therapist as well. She is a licensed counselor who provides trauma-focused cognitive behavioral therapy and other therapeutic interventions to children impacted by trauma and abuse. She actually lives here in Durango and has been commuting to Cortez for the last 5 years. I want to thank her for that. She has been asked to provide mental health services at the middle school because although they received a grant for a full-time therapist, they were unable to secure a qualified provider for this school year. I know of 5 private practice counselors in our area and only 2 other than myself who provide services to children and families. A couple of us often rely on sliding scales or providing services pro bono to meet the needs of our community. I also spoke with several foster adoptive parents, caregivers, and kin. They report there truly is a frightening shortage of qualified mental health professionals for this area, especially for low-income families. You can't be seen right away unless you're in crisis, and you can't get appointments reliably afterwards. For kids in the community, unless they're already in the system or have experienced such significant trauma it can't be ignored, there is practically nothing. Another individual said, this community is lacking compassionate people who genuinely care. When those individuals do show up, they quickly get burned out from all the physical and emotional exhaustion. I do see sources of support. I would say that those individuals who have chosen to reside and or work in Montezuma County are some of the most dedicated and passionate people I have ever met. We are spread very thin, often wearing multiple hats and trying our best to help everyone we can. After speaking with others, the following seem to be areas we can improve mental health resources in Montezuma County. Incentives to live and work in Montezuma County, such as salary increases and student loan forgiveness for teachers, school support staff, and mental health professionals. More local training opportunities and incentives for local providers to get more culturally relevant education so we can meet the diverse needs of our community in sensitive and accurate ways. More education on behavioral versus psychiatric diagnoses for community members so the high volume of clients and limited psychiatric services can be prioritized. More psychiatric services. Thoughtful, collaborative, and organized distribution of resources such as time-limited grants to make sure we're providing the most services we can instead of doubling up where other organizations are meeting the need. More opportunities for behavioral health collaboration with streamlined releases of information so agencies can work together more effectively. More opportunities like this to collaborate on a larger level to develop the support for smaller rural communities. I want to close by being very clear. The work that I do inspires me every day. I feel truly honored to work with amazing and resilient children and their families who are trying against all odds to recover from oftentimes generations of poverty, substance abuse, and trauma. Providing adequate and culturally sensitive services to these individuals and their families will contribute to the stability, health, and progress of our community. I hope that in this time, I have represented some of the unique challenges faced by the people in Montezuma County and our critical need for more support. To remind everyone in this room, unless someone like you cares a whole awful lot, nothing's going to get better. It's not. Thank you.